Let's talk about what happened yesterday in the House of Representatives with the vote for the budget and remind you about something really important. This is not over. And I have some suggestions on things that we can try together to reach people who might not be aware of what is happening. And I'm going to get to that in a second. But right now, where we are is that the House passed a blueprint of what they would like to do. The thing is that the Senate and the House have two different versions of this budget proposal. And so now they have to come together and agree, sort out their differences, basically. And then comes the budget resolution where they have to pull out actual numbers. And after that is where they have to spell out exactly what they're cutting. And that's called the appropriations process. So we're not there yet. And this is where I need your help reaching out to people, encouraging them to contact their lawmakers, encouraging them to invite their representatives to town halls. One of the reasons what's happening with this budget is not connecting with people is because they are not aware that they are receiving Medicaid. Because it turns out that in a lot of states, Medicaid is called something different. So for example, in Tennessee, Medicaid is called TennCare. And so they love their TennCare, they have no idea that they're actually receiving Medicaid. In California, turns out it's called Medi-Cal. And speaking of California, there are two Republican representatives that won their seats by less than 12,000 votes. But for example, the representative of California 22, Valadao, 288,000 people would lose their health benefit. The representative of California 41, again, won his seat by less than 12,000 votes, but there's 142,000 people in his district alone who would lose their health care if this Republican budget passes with the cuts to Medicaid. So we need to continue to put pressure on our elected members of Congress. I think something that we can do is specifically talk about the name of the program and not Medicaid in general so that it connects with people and try it that way. The other thing I'm going to do is list 17 Republican members of Congress who voted for this budget who would have tens of thousands of people in their districts losing Medicaid coverage. But these people barely won their seats, so they're going to be the most susceptible to public pressure. One of the things that I need your help with is spreading the word that this is not all set and done and that we lost. We can still put a lot of pressure on our members of Congress to not do this. So let's get to work, okay?